Good morning, everybody. I am Dr. Durga, Professor in Pathology, Narayanamedicalcollege, Nellore. Greetings to all of you on World Marrow Donors Day. World Marrow Donors Day is celebrated globally on the third Saturday in the month of September every year. The reason for having a special day for marrow donors has two main objectives. The primary objective is to thank all marrow and stem cell donors worldwide. These donors could be the family, the closest relatives of the patient, or compassionate, unrelated donors, or they could be donors who have already donated, cord blood donors, and new donors who are waiting for their turn to donate by registering themselves in the registry. The second objective of having a World Marrow Donors Day is to raise awareness among the general public, health professionals, pharmaceutical representatives, and the researchers about the importance of registering as a marrow donor and the impact of bone marrow stem cell transplantation on a patient's life. With these two objectives in place, there are several questions that are likely to arise in our minds regarding bone marrow transplantation. The first question is, what is marrow and what are stem cells? What are the indications for doing a bone marrow transplantation? Who can become a donor? And what are the complications or adverse effects of marrow donation? Starting with the first question, what is marrow and what are stem cells? Marrow is the reddish yellow spongy tissue which is present within all the bones of our body. The marrow contains multipotent stem cells which have the capacity to self-renewal themselves as well as produce more than 200 million blood cells per day in the body. These blood cells could be RBC, WBC and platelet lineages as well as cells of the immune system. Apart from the bone marrow, the other sources for multipotent hematopoietic stem cells are fetal liver, cord blood, placenta, peripherally induced stem cells in the peripheral blood and embryonic stem cells. Coming to the indications for bone marrow transplantation, there are several malignant and non-malignant disorders of the blood which require bone marrow transplantation. The malignant disorders include acute leukemia, both of the myeloid and lymphoid type, myelodysplastic syndrome, multiple myeloma, chronic myeloid leukemia which is refractory to tyrosine kinase inhibitors, and malignant lymphoma of the bone marrow. The non-malignant disorders include aplastic anemia, Fanconi's anemia, and severe immunodeficiency states. In all these conditions, a bone marrow transplantation gives the patient a chance for survival and possible cure. Next question is, who can become a donor? A healthy individual more than 18 years of age who is willing to donate his marrow can register as a donor. And for umbilical cord blood, a healthy woman in her pregnancy without any complications of pregnancy can register far ahead of her EDD for becoming a donor. Coming to the last question, that is the most important for all of us, does bone marrow donation have any adverse effects? No, bone marrow donors have no adverse effects and the procedure is as simple as donating blood. And marrow is such magical tissue that within 7 days it comes back to its normal state of as it was before it was donated. With these words and with this message, I would like to raise or create awareness among all of us for registering as marrow donors and thus bestowing the gift of life on the fatally ill blood disorder patients. Thank you.